The honourable member Edmonton Strathcona, leader of the ND opposition.
Thank you, Mr. Speaker. The NDP has been demanding action to repair and replace the Misericordia Hospital for several years now. The government has dismissed our concerns along with the concerns of frontline health care providers, patients and their families. Well, today, Mr. Speaker, we understand that the cafeteria roof in the Misericordia, which has been leaking for years, has collapsed. So, to the Premier, why has his government, through their incompetence and their grossly negligent behaviour, been allowed to put the health and safety of Albertans at risk?
The Honourable Minister of Health.
Mr. Speaker, we have tried to make sure that the Misericordia Hospital is operating as well as possible by supplying $25 million to it to ensure that it will continue to operate in an effective way.
For a supplemental.
I am quite concerned by the failure of either the Premier or the Health Minister to take this issue seriously. $25 million is not relevant. What's relevant is that a roof collapsed. West Edmonton has no ER, there's no diagnostic services right now, and meanwhile we have a minister who thinks this issue requires more study. So to the Premier, do you really think your minister's judgment that this requires more study still really warrants the faith and trust of Albertans for him in his role?
The Honourable Minister of Health.
We take very seriously the issues at Misericordia Hospital, as well as any hospital throughout the province of Alberta. We will make sure we do all things to ensure these hospitals are managed properly and they're taken care of properly. Thank you.
Final supplemental.
Wow. Well, Mr. Speaker, years of Tory neglect, both here in the House and generally in doing your job, have come home to roost. West Edmonton has no emergency room, no diagnostics, and a collapsed roof in its cafeteria. To the Premier, what are you going to do to ensure that members of your government are held accountable for this profoundly irresponsible level of neglect?
Honourable Minister of Health.
Mr. Speaker, as I've already said, we're doing all we can at this time. We also know there's a need for acute care improvements across the province of Alberta. We'll continue to look at that, and we'll continue to do that.